Hello, everyone. My name is Jacob Cresswell, and I lead the TB Reach team at Stop TB Partnership. On behalf of my team here at Stop TB and our partners conducting the work for TB Reach, I wanted to share with you some of the highlights of our work this year and also mention some news coming up early in 2021 for new funding opportunities and thinking about the future of TB Reach. Now, 2020 brought a lot of challenges for all of us, but also great successes, and I think we should be celebrating them. I wanted to share some of them with you and the wider TB community as we close the year. This presentation is a modified version of what was presented just recently to our board.
With generous support from USAID, we were able to launch a call for proposals just after World TB Day this year. It was very different in many ways. Wave 8 was only focused on proposals that sought to engage private providers with new models of care to reach more people with TB. We launched the call 10 days after our offices were shut down and we were all beginning to work from home, like in many other countries. We limited the application to only local non-governmental partners from 24 countries, and yet we still had 255 applications requesting about $100 million in funding. We had to recruit and convene a completely revamped proposal review committee, and we had to organize what is usually a 2-week in-person meeting to review each proposal virtually, with time zones stretching from Seattle to Hanoi. But we did it in June with a big thanks to Carrie on our team for pulling these virtual meetings together. And for the first time, we invited our finalists to present their proposals live and field questions from the review committee. In the end, there were 13 proposals funded, with USAID support being supplemented with some remaining funding from Global Affairs Canada. The decisions were approved by the EC in July, and I'm very happy to announce that we were able to convene our 4-day grantee event for more than 100 participants virtually. All grants have been signed, funding dispersed, and a number of the projects have actually already begun implementation. The grant management provided by Pauline on our team in 2020 has been outstanding, and I hope you will agree. From opening a call for funding in late March to service delivery in October, that is fast and efficient, especially with the state of the global pandemic. So, turning to the COVID-19 pandemic and how it affected our grantees and TB services. Like we have all read and felt, our grantees were deeply affected by the lockdown and the closing of health facilities, both public and private, especially in the first half of the year. Numerous projects had to stop any meaningful activities for different periods of time. However, there was great variation across countries and even within countries as different regions were affected to greater or lesser extents. Here, you can see data from current projects showing how we went from more than 30,000 people tested and 1,873 diagnosed with TB in Q4 of last year to about 17,000 and less than 1,200 people diagnosed in Q1 of 2020. The good news is that things rebounded in Q2 back up to about 20,000 people tested and 1,595 diagnosed, but it was not to the level of previous quarters. We will continue to monitor the situation as Q3 data comes in over the next few weeks.
I do want to highlight that our grantees were often in an advantageous situation in many places. Active case finding was the main way people with TB were being reached, as traditional facilities were often shut down. Some projects were the main source of identifying people with TB for a number of weeks or months. But our grantees worked to support the COVID response in different ways as well.
They conducted trainings on PPE and outreach efforts. They developed guidelines to integrate TB and COVID screening at quarantine and isolation centers. Numerous existing community health workers were moved onto the COVID-19 response teams. Grantees adapted, as we all have, to using telephone, Skype, WhatsApp, rather than in-person visits to support people with TB. And they took advantage of the digital adherence technologies that had been introduced by Wave 6 TB Reach projects in a number of countries. They also supported local facilities in the fields with X-ray units, and in a few of them actually served as regional COVID-19 coordinators to help screening and outreach efforts.
So we are very grateful to Global Affairs Canada for the flexibility that we could provide to our partners to procure PPE for frontline health workers and support some of the joint TB COVID outreach efforts that came about. It speaks to how quickly TB Reach projects can react to changing realities and situations in countries.
Despite the pandemic, TB Reach continues to produce results. More than 323,000 people with TB were detected and treated, and more than 90% of TB Reach grants have improved case detection and treatment outcomes. The critical support that Global Affairs Canada provides has allowed TB Reach grantees to advance our knowledge and evaluate new tools and approaches to reach more people with TB beyond what is in WHO recommendations. I thought I would ask some of them to tell you themselves. Here is Yannick Russell, who works in Bamenda, Cameroon.
Through TB Reach Grant, we have been able to test a number of new tools and technology. Currently, we are running evaluation on Fujilam, Expert Ultra, and TrueNat MTB Plus assay. We are trying to bring the latest technology and the best evidence to Cameroon.
This laboratory is doing some amazing work with TB diagnostics and is a wonderful model for the region. Next, let's hear from Professor Luis Cuevas at Liverpool and an exciting line of work he is looking at, not using new tools, but a new approach to save expensive expert cartridges in active case finding.
Through our early work in TB Reach, we tested for the first time a system where sputum is pulled together to test 4 people at once to save expert test costs. Our results are promising, potentially saving up to 30 to 40% in test cost and processing samples in less time. We are expanding the evaluation of the approach in multiple countries to see how this can work in different settings.
And now, to move to Pakistan, where we have some exciting developments on a tool some of you might have seen at the Union last year that could bring in a new way to screen people in remote areas.
We are exploring all possible avenues for leveraging innovative and convenient chest X-ray screening for use in remote communities for both TB and COVID. We possess this new handheld X-ray device equipped with artificial intelligence, thanks to the partnership. That equipment can access the hard to reach communities and bring both TB and COVID screening closer to rural areas of Pakistan. Our experience so far has been exciting.
Thank you, Karam Shah.
I also want to highlight an important milestone just recently, thanks to investments that were made by TB Reach in the Ukraine. Our local partner, Oath, with support from KNTV, was able to enroll the first people on the BPAL regimen under programmatic conditions, not a trial. We do expect those numbers to grow quickly, and other donors, like South Korea, are now making investments in expanding access. This is another example of TB Reach providing the early pathway for new ideas and approaches a few months after the WHO issued guidelines. And finally, just to mention that we are enrolling people on novel preventative treatment regimens in different countries, and we are using and evaluating new tests for TB infection and other tools. We will continue to hear more about this work as the results are published in the coming months and into next year.
So speaking of publishing results, 2020 was a great year for TB Reach. As to date, we have more than 20 peer-reviewed publications accepted and published. I will give you some quick highlights and then let a few more colleagues tell you about their work in their own words. We recently were asked to write a piece on the work that TB Reach has done to support partners in the Asia-Pacific region as we move towards ending TB. I can say that writing this piece with collaborations from our M&E colleagues as well as Global Affairs Canada, it was really inspiring to see how much has been done and is being done in the region and the investments that we have made there. While my team here is supporting many grantees to document their results, we also work with the great M&E colleagues and with McGill to help get our results to a wider audience. Currently, we are working on several meta-analyses since we have so many projects conducting different types of interventions. One of them, a costing analysis with Johns Hopkins University, should be finalized early next year. But we are also working on a number of other projects as well, including the overall impact TB Reach grants have on case detection and notification, private sector engagement impact, one specifically on pharmacies as the first point of care for many people, digital adherence technology, and a large review of how different projects engage community health workers. Now, let's turn to some of our grantees publishing their results this year and let them tell you a little bit about them. Suraj, do you want to start us off?
I'm Dr. Suraj Abdul Karim from Superbell Community Development Initiative, a non-governmental organization working in northeastern Nigeria. We are TB Reach Grantee. We're 5. We have spent a year doing TB HIV screening among internet displaced persons who plead Boko Haram. We documented increasingly high rates of disease. The case finding, we did dramatically increase notifications in the states where we worked and reached these people who will otherwise have no good access to care. After completion, a successful completion of this project, we have secured additional funding from Global Fund to continue a number of these activities. Thank you.
Now let's go back to Pakistan, where Shifa and the CHS team have been doing great work in documenting the performance of artificial intelligence to read chest x-rays.
TB Reach has supported various interventions using active case finding and also artificial intelligence to read chest x-rays. We have conducted multiple evaluations of AI products, and just recently we've published the findings of using AI to screen people with diabetes. And the results have been promising.
A few days ago, Ramya from Reach just published some very cool results from a public-private partnership in Chennai. Ramya?
Hi, I'm Dr. Ramya from Reach, an Indian organization working for TB care and prevention for the last 21 years. Through a TB Reach grant, we undertook an innovative public-private NGO partnership to increase case detection among household contacts of people with TB in Chennai city. Our study published in PLOS 1 compared how many people with TB could be detected using expert and X-ray as compared to the standard approach of using symptom screening and sputum smear. The standard approach could only detect 25% of the people diagnosed using X-ray and expert. Thank you.
Staying in the region and the topic, let's hear from ICDDRB and Dr. Sonia about a large intervention they developed and evaluated.
The results of our study are striking for private sector engagement. We set up 3 screening and testing centers in Dhaka, and through our network of private sector engagement, we diagnosed about 30% of all TB notification in the city. Our social enterprise model was supported by TB Reach, USAID and Global Fund and contributes its own revenue stream. Our operation is now expanded in 10 centers across 3 cities.
And last but not least, Elvi, can you tell us about your work in Indonesia?
Hello, my name is Elvi Syam from Yayasan Menara Agung Pengharapan International Indonesia. Indonesia is a country of many remote and hard-to-reach islands. For our TB Reach project, we mobilize community to conduct active case finding, supported local laboratories, and work with leaders to advocate more funding for TB. Our project increased case finding 85% and identify more than 1,000 people with TB. This is only possible through community engagement. Thank you, Stop TB Partnership, for your support.
I find it amazing that despite the incredibly high burden of TB in Indonesia and all of the great work that is going on there, this peer-reviewed paper is the first one to document the results of community-based active case finding for TB in the country. Elvi, congratulations to your team. There have been many more as well, but I only have 30 minutes, so I just wanted to give you a few highlights.
The publication of results in an ideal situation leads to informing policy. TB Reach's input into global policy is a core KPI of the Stop TB partnership. 2020 was a year that our team spent a huge amount of time and energy supporting the policy development process. The largest WHO policy review this year was around different aspects of active case finding to update the screening guidelines originally published in 2013, for which TB Reach provided the M&E framework. Now, the guidance isn't out yet, so I can't say anything about the results, but I should give a tip of the hat to Matteo, Dennis, and especially to Cecily at WHO for their work on this, as it was a massive review of many different aspects of screening, reviewing data on the impact of active case finding, to looking at different tools used and populations and costs as well. I am proud to say that TB Reach provided a huge amount of data to all different aspects of this review. One of the newest aspects of the review was around artificial intelligence to read chest x-rays. And working with partners in Cameroon, Nepal, South Africa, and Bangladesh, we have been able to assemble one of the largest and most diverse evaluation sets of different artificial intelligence software available. Our team here in Geneva is led by Zhijen, who has done an amazing job at developing a new framework for evaluating the reading of the chest x-ray images, and has led the thinking around the technology, including the development of a website and landscape analysis for artificial intelligence, which has been done in collaboration with Find. It is a great example of the work Stop TB is leading in the digital health area. TB Reach evidence was also used, of course, in documenting the impact that active case finding can have on improving TB notifications, detecting people early, and a number of TB Reach publications were used in the first analysis of how active case finding can impact catastrophic costs for people with TB, as well as the health system costs, which I think highlights how TB Reach has been able to inform many different aspects of the TB response that is needed for evidence for policy. Another area of work I want to highlight for you in the policy arena is, as you have heard here, we invested heavily in Wave 6 on projects that use different digital adherence technologies, and Amara from my team has been making huge efforts to document those results for more than a dozen projects. And together with Jackie, she led the task force on DATs, and they have been instrumental in supporting the development of implementation research tools with KNCV, WHO, and TDR. At a national level, there are a number of examples where TB Reach grantees have been able to demonstrate the usefulness of different approaches that can be incorporated into national policy. I want to invite Luan from FIT in Vietnam to tell you briefly about some exciting work that he has been doing.
TB Reach helped to document large numbers of people with TB treated in the private sector who were unknown to the National TB Control Program. In 2 pilot districts, we identified half the number of people with TB that were notified at the national level in a year by true private providers. Through scale-up funding, we are now working with the NTP to record privately treated people with TB in the official recording and reporting system of the government in 3 major municipalities of Vietnam, which we hope will lead directly to increased notifications of previously unreported persons with TB.
So as we move from implementation to results and policy change, I just wanted to give you a few examples of our ongoing efforts to help our partners and TB programs take their efforts to scale. In Tanzania, Global Fund and TB Reach are supporting a large scale-up of engaging local drug sellers to improve case detection that is involving more than 1,000 drug retailers. And it was piloted in a Wave 6 TB Reach grant. Now I'll let my friend Stephen give you a brief description of their work in Nigeria.
I am Dr. Stephen John from Jana Health Foundation. Our organization works with nomadic population in northeast Nigeria. With funding from TB Reach, we were able to confirm the huge burden of TB among nomadic population and also implement a successful TB control project. The intervention has been incorporated into the National Strategic Plan for TB Control, and funding has been secured from the Global Fund to continue a number of these activities. Thank you.
Thanks, Stephen. Amazing stuff. Now I have Alex Kitiamuesi from Uganda, who wasn't able to provide video, but we can hear him talk about the work they are doing and efforts to scale digital adherence technologies.
Hello, my name is Alex Kitiamuesi. For the first time in Uganda, we implemented 99 dots to empower and support 6,000 people with TB to take their medications. Because of our TB Reach project, using digital adherence tools is now part of the national TB response and is incorporated for scale-up into the funding request for Global Fund.
It's really great to see some of these DAT grants move from proof of concept to Global Fund funding in such a short time. Finally, we are currently working with USAID as part of TB Reach Wave 8 grants to strengthen the capacity of local organizations by providing assistance on a range of organizational issues. This is a different part of planning for sustainability, which we are quite excited about and thankful for the support from USAID. And so all this in less than 11 months, and I could go on, but time is limited, so I want to move to our plans for next year and beyond with the next phase of TB Reach.
And now for some exciting plans I want to share with you. We are currently working with USAID to develop the framework and plans to launch a Wave 9 for TB Reach in late January 2021. USAID has committed an additional $4 million, and we are going to launch a call for proposals that is focused on a new area of work, improving service delivery for people with drug-resistant TB. The call will focus on 3 specific areas. Improving linkages to care, as globally we know there's a large gap between people detected in laboratories and those who initiate treatment. Expanding access to novel all-oral treatment regimens as part of programmatic care delivery, and improving treatment outcomes, which we also know are quite low at a global level. This work is being led by the newest member of our team, Tofik, who joined only a few months ago but has really hit the ground running. We expect that we will have a proposal review committee next summer and hope to start implementation in late 2021 or early 2022. Again, an example of using the TB Reach platform to address a global priority and source local solutions, even if it is not related specifically to case detection. 2021 is a critical year for my team as well as the partnership in general, as the current TB Reach grant with Canada is coming to an end, and we need to secure more funding from Global Affairs and other donors. Over the course of this year, we have refined our vision of what TB Reach 3.0 can be and what it should be, with the help of new funding commitments, as well as the realities we faced through a global pandemic that can deliver funding to implementers through an independent process that sources ideas and innovations from our partners. Over the years, we have advertised funding calls that have requested innovative ideas for TB in mining, implementation of expert testing, vulnerable populations, private sector engagement strategies, empowering women and girls, digital adherence technology, and now drug-resistant TB. The platform has been the same. The process has been quick, and at the end of the day, TB Reach grantees provide impactful results that are taken up by national programs. TB Reach grantees are among the first to evaluate new tools and technologies, from things you heard about today, maybe for the first time, such as handheld X-ray cameras, or drones, but also new regimens to treat infection and disease. Not all of the projects are successes, but we can learn from them all, and we are working hard with multiple partners to document successes and challenges. These results provide evidence to support local and global policy development. These are things that matter in the long term as we move the TB response to get back on track to meet the UNHLM targets.
The support provided to TB Reach is to fund service delivery for people with TB. We have caps on centralized human resources, overheads, and technical assistance.
More than 80% of our funding goes to partners to deliver services to those in need, and we expect that to continue in TB Reach 3.0.
Thanks so much for watching. On behalf of my team and the Stop TB Partnership, and most importantly, all of the people who have TB, who TB Reach works to help, I want to thank you for supporting TB Reach, doing your amazing work with TB Reach grants, and generally supporting our common goal of ending TB. We look forward to engaging with partners new and old in 2021, and wish you all a safe and happy end of 2020.